Welcome to the Waterbury Hospital Joint Replacement class. Objectives. At the end of this session, you and your family will know what you can expect before, during, and after your joint replacement surgery, the role of each of our members of your healthcare team, how the members will help you throughout your hospital stay, and what you can do to prepare yourself and your family for your upcoming procedure. What shall I bring to the hospital? Important things for you to bring to the hospital will be your insurance information and insurance cards, a list of your medications with complete names and dosages, including the decimal points. You may leave your actual pills at home. Please bring with you a list of allergies, toiletries such as toothbrushes, toothpastes, combs, dentures if applicable, and eyeglasses. Please note that you cannot wear contact lenses during surgery. What shall I bring to the hospital? You should bring a comfortable, well-fitting shoe, socks, pajamas or a nightgown, only if you prefer to wear your own, reading materials, a front-wheeled walker if it has not been evaluated by a physical therapist during your preoperative home assessment visit. If it was evaluated and is considered suitable, you do not need to bring it to the hospital. A CPAP machine with its settings and other items you think you will need. Please leave expensive jewelry, credit cards, and other valuables at home. Pre-admission testing. About 2 weeks before your surgery, you may be scheduled by your surgeon to come to the hospital for outpatient lab for preoperative testing. Blood test, EKG if needed, X-rays will be performed. You will also have a scheduled preoperative visit with your primary care physician. Hospital to home program. Unique to Waterbury Hospital, our hospital to home program will ensure that you return home from the hospital safely and comfortably. A physical therapist will come to your home prior to surgery to review post-operative exercises, perform a home safety evaluation, and assess the need for any necessary home equipment. A physical therapist and/or registered nurse will come to your home on the day of discharge or on the next day to review your rehab plan and to help you settle in. A nurse may also call you the evening of discharge. If you are identified by your surgeon as a good candidate to return home same day as the surgery, you will work with a physical therapist at Waterbury Hospital before being discharged to your home. A nurse will visit you at your home or call you on the day of discharge, and a physical therapist and/or registered nurse will visit you on the following day. Your therapist will develop a customized plan of care after surgery for ongoing physical therapy in your home. A nurse will visit you at your home if necessary to check your vital signs and surgical site and answer any questions you may have about medications and your recuperation. The day before surgery. The day before surgery, a nurse will call you on the business day before your operation to tell you what time your surgery is scheduled and what time you need to arrive at the hospital. The actual time of your surgery is not known until about 1 p.m. on the business day before surgery. The nurse will review with you any medications that you are currently taking and which ones, if any, you may need to take the morning of surgery with a sip of water. The night before surgery. The night before surgery, do not apply lotions or moisturizers either the night before or the day of your surgery. Use a skin prep cloth as directed. Skin preps will be obtained from the therapist at your pre-op assessment. If you are not participating in the hospital to home program, please contact your surgeon to obtain the skin prep. Do not eat or drink after midnight. You may have one carbohydrate drink up to 4 hours prior to your arrival time as directed by your surgeon. The day of surgery. Do not wear any jewelry, nail polish, makeup, or contact lenses to the hospital. Do not shave or wax the operative site. You may wear your hearing aid. Please wear comfortable shoes and clothing If your walker has not yet been sized by physical therapy, you may bring it with you to have it sized at the hospital. Day of surgery. You should arrive at the hospital at the time you were instructed by the one-day surgery nurse. Upon entering the front of the hospital, report to outpatient testing to check in, located to your left in the lobby. Then follow the signs to one-day surgery reception area on the first floor. Day of surgery. Staff will escort you to the preoperative area. Family, friends are welcome to wait with you before surgery. Here you will get ready for surgery. A nurse will obtain a mission assessment, including vital signs such as your blood pressure, pulse, etc. An intravenous line will be placed in your hand or your arm. You will be evaluated by an anesthesiologist prior to surgery to review your health history and discuss the best type of anesthesia for you. A written consent will be obtained for the anesthesia to be administered. If you are prone to motion sickness or have had problems with nausea and vomiting after previous surgery, inform the anesthesiologist when they interview you before your surgery. They will give certain medications to help you with this problem. Most total knee and total hip patients will have spinal anesthesia with a regional nerve block. Regional nerve blocks are administered in the post-anesthesia care unit preoperatively. This is performed by an anesthesiologist. The nerve block provides long-acting anesthetic around the nerves that supply the hip or knee. The goal is to achieve effective pain control while minimizing side effects caused by common pain-relieving drugs. In the operating room, spinal anesthesia with light sedation is most often used for joint replacement surgery. Patients with spinal anesthesia typically have fewer side effects, such as postoperative nausea or vomiting. We welcome family members to wait in the reception area while you are in surgery. If your family chooses to wait elsewhere, the doctor will call them at that location after surgery. The phone number may be one you do not recognize. Please answer. Your belongings will be placed in a labeled bag and sent to the recovery room. No valuables should be left in your bag. You will be transported to the post-anesthesia care for your preoperative nerve block. When the operating room is ready for you, you'll be taken to the OR on a stretcher. You'll be awake upon entering the operating room. In the operating room, the surgery generally takes 1 to 2 hours. The actual surgery is only part of the time. Anesthesia and monitoring take time too. When the surgery is done, you are brought to the post-anesthesia care unit. When your surgery is completed, the surgeon will visit or call the reception area to speak to your family or significant other. While in the post-anesthesia care unit, you will be placed on a cardiac monitor and given oxygen. The oxygen is left on until the effects of anesthesia, sedation, and narcotics wear off. While in the post-anesthesia care unit, you are assessed every half hour to 1 hour. You may feel some incisional pain as you are waking up in the post-anesthesia care unit. You will be medicated as needed. An x-ray is taken of your new joint while in the PACU to confirm the position of the new prosthesis before starting to put weight on it. If spinal anesthesia has been used, you will be awake but a little drowsy upon arrival to the post-anesthesia care unit. Your legs may feel numb with the inability to move them. As the spinal wears off, your feeling will return and you will start to be able to move your legs. We will check your sensation level and your ability to move your legs frequently. Numbness may begin just below your navel. You will have some pain after surgery, but it'll be different from the pain you've been living with. This pain gradually decreases with time as healing occurs and as you begin to mobilize. Pain medication will be given as needed. Transferring from the recovery room to the orthopedic unit. Once your nurse and your room are ready on Pomeroy 7, you will be brought to the orthopedic unit in your bed by the transport team. You will be awake, but you may still be drowsy. On arrival to the unit, the orthopedic team will orient you to your room and get you settled in. Your diet will be advanced as tolerated. Depending upon how you are feeling, you can expect to get up and walk with a physical therapist or nurse the day of surgery. The average length of stay after a total joint replacement, including the day of surgery, is 1 night. Some patients are able to be discharged home the same day. Please have a discussion with your surgeon preoperatively to see if you would qualify. Typically, you'll be discharged by 10:30 a.m. the day after surgery if you stay overnight. Postoperative care, incision, and dressing. You will have a dressing on your incision immediately after surgery. The dressing will be cared for according to your surgeon's preference. If you have staples or sutures, they were removed after 14 to 21 days. Staples and sutures can be removed by the visiting nurse at the rehab facility or at your surgeon's office. Some patients have absorbable sutures, and some also have a surgical glue, and there are no sutures or staples to remove in this case. Your surgeon may apply an Aquacel or another impervious dressing over your surgical incision. This dressing may remain on for up to 14 days. Postoperative care. There will be an intravenous line in your arm. This will be attached to fluids until you are tolerating food and drinking well. Once you are drinking sufficient quantities of fluid, the IV fluid will be discontinued. The IV catheter will likely remain in your arm till just prior to your discharge. Postoperative blood work may be drawn early in the morning as ordered by your surgeon. Positioning for your total knee. Your legs will be elevated to promote circulation, decrease swelling, and prevent blood clots. You may use a pillow under the calf according to your surgeon's instructions, but do not rest the knee with a pillow under the knee. Positioning for a total hip. Your legs will be elevated to promote circulation, decrease swelling, and prevent blood clots. A pillow will be placed between your legs after surgery to prevent you from crossing your legs. Further precautions will be at the direction of your physical therapist and surgeon. Postoperative care comfort. You will need to ask for pain medication. It does not come automatically. This is to prevent oversedation. The discomfort you may experience after surgery is much different than what you're experiencing now. After surgery, the discomfort is from your incision and the muscles underneath. This gets better as the day goes by. Your pain control will be multimodal and will be approached from several different angles. Pain medication can be delivered by injection or by mouth. You may receive injections initially and transition to pills before discharge. If you need more help with your pain management, please talk to your nurse, the PAs, or your surgeon. Postoperative care, breathing. Lying in the bed, anesthetic agents and narcotic pain medication cause you to breathe more shallow than you normally would, so that you do not fully expand your lungs. This can lead to respiratory complication. In order to prevent such problems, you will be encouraged to perform deep breathing exercises by using a device called an incentive spirometer. Using your incentive spirometer after surgery will help keep your lungs clear. Performing these exercises will prevent fever, decrease oxygen levels, and pneumonia. In order to use the incentive spirometer, you should hold the incentive spirometer in the upright position. Breathe out normally, then place your lips tightly around the mouthpiece. Breathe in slowly and deeply as possible, raising the yellow piston towards the top of the column. Hold your breath as long as possible. Blow out your breath normally and rest for a few seconds. Repeat these steps at least 10 times an hour while awake. If you awaken during the night, perform several repetitions before returning to sleep. Exercises postoperatively. Motion. Moving your arms and legs while lying in bed is extremely important to improve circulation. This will not affect your surgical outcomes. Being immobile can lead to a variety of complications, including blood clots and pressure sores. Immediately after surgery, mechanical foot bumps will be placed on both of your feet to prevent your blood from pooling in your leg veins. They will be on your feet whenever you are in bed. Also, the foot of your bed will be elevated to promote circulation and prevent swelling. You'll be encouraged to perform ankle pumps by moving your ankles up and down as if using a gas pedal. This should be done as often as possible. Prevention of blood clots. Blood clots can be a complication following any joint replacement, around 1 to 2%. We have many ways of preventing blood clots, the most important being motion, particularly walking. It is important for you to get out of bed and walk as soon as possible. Remember, only get out of bed with the assistance of a staff member while you are in the hospital. Once you have walked as far as you can, you will be allowed to sit for a short period of time. While sitting, your therapist will assign therapeutic exercises, and then you will walk back to your bed. Sitting for a long period of time can lead to the formation of blood clots and promote swelling. Besides the mechanical foot pumps and ambulation, you will receive a medication to prevent blood clots as well. This is according to your surgeon's orders. This medication will be continued after discharge for several weeks. Lightheadedness. You will be getting out of bed with the assistance as soon as possible after surgery. Do not be alarmed if you feel faint or lightheaded. This is normal due to anesthesia, blood loss, medication, and simply lying in bed. You must communicate with your nurse and/or therapist if you feel faint. Often lightheadedness will pass and therapy can continue. If not, you may return to bed and try therapy again later. General precautions. There are special instructions associated with each joint replacement. These continually will be reviewed with you during your stay. Instructions for home will be written out in your discharge instructions brochure. You will need to let your medical doctor and your dentist know that if you've had a joint replacement. You will be required to take antibiotics before dental treatments in the future. On occasions, you may trigger the metal detector at airports. Usually this is not a problem as millions of patients have orthopedic implants. A note for your surgeon will not help with this. Physical therapy. Physical therapy will begin on the day of surgery. Physical therapy is provided 7 days a week, twice per day, directly on the orthopedic unit. PT consists of practicing walking on your new joint replacement, exercising, stretching, practicing stairs, bed and toilet transfers. Most patients will return home the following day. Discharge planning. After a knee or hip replacement, there is no place like home. Patients will return home with the guidance of our hospital-to-home program. Our goal is for you to return to home and your active lifestyle. You can expect to receive physical therapy in your home until you are safe to begin therapy in the community, if it is prescribed by your surgeon. Discharge planning. A case manager will meet with you after your surgery to begin evaluating your discharge needs. The case manager consults with other members of the team to determine appropriate discharge plan based on your progress. She will ask and address common home care questions, such as, do you have someone to help you at home immediately upon discharge? We call this person a champion. It is very important for you to find your champion before you come to the hospital for your elective surgery. They will ask other questions such as, do you have stairs to get in and out of the house or up to the bedroom and/or bathroom? Are you able to manage your medications on your own or do you need assistance? Your goal after joint replacement is to achieve maximum function and independence. It takes about 12 months to fully maximize your strength and range of motion, although most patients are independent within weeks. Your strength, endurance, and ability to ambulate without assistance, as well as your ability to transfer in and out of bed and the bathroom, are milestones which must be met to achieve that goal. Over the course of your hospital stay, your ability to perform these tasks, taking into consideration your medical conditions, is continuously evaluated by the team. It is vitally important that you look into your insurance plan prior to coming to the hospital. Most insurance plans cover specific providers of home care. While you may wish to use an agency that your friend or relative used that is close by, it may not be covered by your insurance. Making a phone call to your plan's 1-800 number can get that process started. Also, make sure you bring your insurance cards with you so that case management has all the current contact information to expedite your discharge plan. Discharge planning. If you stay overnight, you will be discharged by 10:30 a.m. the following day. Please make sure that you have a ride available that time. Do not forget to bring your insurance information with you. If you have any questions regarding your discharge needs, please call the Department of Case Management Services at 203-573-7072 or 203-573-7082. The visiting nurses service phone number is 860-274-7531. Discharge precautions. Your exercise program is not temporary but continuous. It is an important part in the ongoing management of your joint replacement. You may place pillows under your ankles to elevate your legs if you have had a knee replacement. Do not place pillows under your knee. Continue to use your walker or crutches until you are given further orders by your doctor or therapist. When you are allowed to use a cane, please hold it in the hand opposite your operated leg. Whenever you stand or sit, make sure to hold on to the bed or chair. Never hold on to the walker to stand up or sit down. Use stairs only as necessary and not as an exercise right after surgery. When going upstairs, lead with the unoperated leg, and when coming down, lead with your operated leg. Make sure you discuss kneeling and bicycle riding with your physician before attempting these activities. Discharge medication. In addition to the medicines that you regularly take, you will be sent home with medications specific to your surgery. These may include pain medications, medications to prevent blood clots, anti-inflammatory medication, and possibly anti-nausea medications. You will need to have the contact information for your pharmacy readily available to make this process as smooth as possible. Thank you for choosing Waterbury Hospital for your joint replacement. We will do our best to make your upcoming stay a safe, comfortable, and pleasant experience.